Hello, I'm Malcolm Morrison. I'm the project manager for the Streamlined Contracting with NGOs project. I'm going to give a bit of an overview about the project and what we're aiming to achieve and how we're going to go about doing that. What the project's about, I guess the project is really about two things. One is implementing a new, effectively a bit of an all-of-government contract with NGO providers. So new contracting framework, there's a suite of contract and contract management tools that form part of that contracting framework. The other component is to try and provide some tools and things that will help government agencies work better and more collaboratively with their NGO providers. I guess there are probably three main outcomes that we're looking to achieve from the project. One is, and the primary one, is to reduce the compliance burden for NGOs. The second is to reduce the duplication of contract management activity done by government agencies. We all tend to do lots of the similar sorts of activities. We think we can reduce that a little bit. And I guess the third one is to look to develop a bit more of an outcome focus in our contracting arrangements with NGO providers. And that outcome focus is really more about just making sure there's a link between whatever services we might be purchasing and an outcome that we're looking to achieve both at a client level and at a population level. In terms of background, in 2011, the Minister of Finance had a meeting with Treasury officials organised with a range of government agencies and NGO providers, and during that workshop they identified a number of problems that the government had when it was contracting with the NGO sector. I guess the main one was because there are so many different government agencies and they all generally take a slightly different approach to how they contract with the NGO providers, those multiple approaches meant there was a lot of duplication of activity, but all done slightly differently, and also a lot of duplication of audit, reporting, those kinds of things that if we worked a little bit more collaboratively together, we could do quite a bit better and reduce the compliance footprint for NGOs. The second thing was that most of the government agencies' focus appeared to be on counting numbers through programs as opposed to focusing on what outcome was being achieved by those people attending those programs. And the third was that to better support the coordination, it was quickly identified that there was a lack of tools available for government agencies to actually know who they should be working with in other government agencies to reduce duplication and to streamline their activity and coordinate it a bit better. As a result of that workshop, the Minister of Finance directed what was then the Ministry of Economic Development, who I used to work for, which is now Ministry of Business, Innovation and Employment, or MBI, as I'll probably refer to it for most of the rest of the presentation, directed us to undertake a pilot project to see if we could find some ways to get all of the government agencies working off the same song sheet, and in that sense working off a single set of contract terms, and also hoping to address some of the problems that were identified just here. A few details about the pilot project. There were 6 NGOs covering geographic locations from Whangarei down to Dunedin, a range of NGOs, both large and small, doing a range of services from social services, justice, public health type stuff. And I guess to give you a bit of context about who those NGOs were, one was Ngātahini Health Trust in Whangarei, another 155 Community House also based in Whangarei, the WISE Group based out of Auckland, Mana Social Services Trust based out of Rotorua, Kokori Marae based out of Seaview here in Wellington, and Anglican Family Care based down in Dunedin. As part of the pilot, in addition to working with the NGOs, we also worked with 4 government agencies as well as Treasury, who, given the Minister of Finance's direction to start the project, they wanted to have involvement and provided some value along the way as well. The 4 government agencies involved were Ministry of Justice, Ministries of Health, Social Development and Te Puni Kōkiri. I guess one of the things that we looked to do as a collective was to co-design a new framework that would address those problem areas that were identified on the previous slide. We also wanted to test whether the new framework that we'd developed could actually work, so we actually got some live contracts as part of that pilot activity. And we also worked with that group to identify how we might better facilitate the coordination and consistency and approach for government agencies when they're contracting with NGOs. The end of the pilot project, we reported back to ministers who directed us then to roll the program out more widely across a 3-year period. So the pilot was successful enough for ministers to want to take it further. In terms of where we landed, the contract and contract management framework, we think we've created a kind of one-size-fits-all contract, so it can kind of be used for everything from, I guess, inputs, outputs, outcomes type stuff. It will apply equally and can be used for those. It's also flexible enough, I guess, to pick up the small bilateral arrangements right through to the more complex multi-party arrangements. We wanted to create, as part of having a standardised set of contract documents, a bit of a standard look and feel for those, so that an NGO provider, when looking at these contracts, would be largely looking at the same thing. So if they're looking at a justice version or a social development version or a health version, they have that same look and feel. What was stressed to us in the pilot was don't underestimate the value that has for providers, instead of giving them lots of different things to look at. The other thing that we look to do as part of that streamlined contracting framework is embed a bunch of relationship principles that some agencies use, but not all. And those relationship principles talk to things like working openly and collaboratively and in good faith, and communicating promptly and the like. So there are a number of those principles that feature in the new contracting framework. The other thing that we observed was the various contracts that government agencies used, I guess, demonstrated quite a different approach to identifying, assessing and managing risk. And that probably accounted for a lot of the differences between the way different government agencies contract with NGO providers. What we looked to try and do was get a more unified approach to the assessment and identification of risk, because if we take a more consistent approach to that, we should end up in a better place for the NGO provider, and that the current problem of us all doing things a little bit differently based on different risk assessments is largely mitigated. So it's a little easier on the NGO. And the final area where we landed was we wanted to develop contracts that had more of an outcome focus than the contracts we currently enter into, which may be either input or often output driven. But at least creating a link between the service and the outcome we were looking to achieve means that we can hopefully direct more of our resources, I guess, into those frontline services to make sure that the services we're buying are actually making a positive difference for the clients or end users of those services. In terms of the contract framework, I will just describe that briefly. The framework terms and conditions themselves are a standardised set of contract terms that would apply across all contracts that government agencies enter into with NGO providers. They're designed to be website based, and we would look to house that on our procurement.gov.nz website. The intention there is that they are all incorporated by reference into each outcome agreement, which is effectively the piece of paper that you sign to purchase services from an NGO under the new contracting framework. By incorporating those framework terms and conditions by reference, it means we don't have to sign them every time, and it also means that an NGO has some comfort that the terms that they enjoy with the government are no more or less favourable than their other NGO providers. The government agency agreement, which is the second of 5 parts of the contracting framework, is designed to represent contractual commitments that each of the government agencies that participate in the Streamlined Contracting initiative make to MB as the coordinating agency. Most of those commitments are based around improving collaboration and coordination of activity, and in particular they focus on, I guess, the timing and content of common things that each of us do in a contract management space, whether that be reporting or auditing or what have you. So that's what those documents are, that's what that particular document is designed to do. The provider is not a party to that particular document. That is just between MB and the government purchasing agency. The decision support tool is the next document shown on the slide. That document is designed as a tool to assist agencies better manage and identify risk when they're contracting with NGO providers. The tool itself is designed to assess a number of different risk areas, and then it provides a bit of a framework for thinking about what you might do about those risks and how you might manage or mitigate those. But I've got a couple of more slides to speak more specifically about that decision support tool that I'll come on to shortly. The outcome agreement is the 4th document in the suite. That's the document that you actually sign. It's got all the important details like the outcome you're hoping to achieve, the services, the dollars, obviously important, the performance measures that you want the NGO to meet along the way. There's also a number of variable components to that for other areas where the framework terms and conditions provide some flexibility. As I mentioned earlier, it's a pretty flexible document, so it can work for what some agencies would describe as high trust contracts, where a feature of lots of current high trust contracts is payment in advance to the NGO provider, and that will appeal to some agencies. Won't appeal to everyone, but it's not to say that the mechanism itself in the outcome agreement isn't flexible enough to cope with that. The other thing that the outcome agreement does is it provides a basis for, I guess, what we think of as integrated contracts too. So those where we've got multiple government agencies contracting with a single provider can cope with those, as it can easily cope with more traditional bilateral one-on-one contracting arrangements. In terms of the outcome agreement, the other thing the outcome agreement does look to embed is some results-based accountability principles, or RBA. Those RBA principles drive the performance measures that we want to see in the outcome agreement, and there's further information available about RBA later in this presentation and also in one of the other presentations we're looking at running. The final piece to that contracting framework is the Outcome Agreement Management Plan, or OAMP. That particular document is intended to be a series of non-contractual commitments, but it's designed to be an aid for the government agency and the provider in terms of making sure that their contract management practice is appropriate and fit for purpose and sort of follow good best practice approaches. It's also designed, again, like the outcome agreement, with maximum flexibility. There's lots of areas within that outcome agreement management plan where there are options for whether you want to include further detail on particular things. So we want that particular document to be scalable. So if you've got perhaps a strategically important relationship, or you've got another relationship that perhaps is very important from a provider perspective, or you've had difficulty with managing that relationship, you might want to invest the time in doing an OAMP to hopefully get a better working relationship with your provider. It's an optional document, and I guess we think that for some of the lower value contracts, you just might not bother spending the time doing that. But that's entirely at your discretion as to whether you want to do that, and it may be that your provider wants to do one because they can see real value in it, or you see real value in it. Entirely over to you. The next slide here just shows who are the parties to each of the various documents. And in general, the parties for most of the documents are just the NGO provider and the purchasing agency, which is a government agency who's buying the services. The only exception to that is the government agency agreement, where that is just between the purchasing agency and MB as the coordinating agency. I mentioned before that identification and management of risk was a pretty key area for the project. What we found during the pilot was there was, I guess, plenty of room to improve the way government agencies identified and manage risk, particularly in terms of trying to get a more consistent approach across government. One of the things that our decision support tool tries to promote is, I guess, more consistent identification and management of risk, but also that management and mitigation step is proportionate to the risk that's been identified. That was certainly something that came up a few times in the pilot, that some agencies, I guess, managed or mitigated a risk perhaps more than the provider felt they needed to. So hopefully this drives a little bit more at that consistency point. The other thing that the decision support tool does is it looks to provide a structured framework for thinking about risk identification and what you do with that. The next few slides are largely about that decision support tool, and I've got some particular slides that run through some screenshots about just what it looks like. The decision support tool, this is one of the screens from that. On the under the provider heading there's a number of risk areas. We effectively call those assessment areas, and for those assessment areas we're looking to get the government agency to think about whether the provider is good, bad or indifferent in those areas, and what we've created is a scoring regime down the middle, a position for you to put a few comments about the reasons why you've scored what you have scored. And in terms of the scoring guide boxes there, those, when you click on those, they represent word pictures. And so as a user of that decision support tool, you would have a look at the question on the far left, and then the word picture in the scoring guide, see which one lines up best for that particular provider, insert that in, plus any comments you might want to make, and that's largely how that particular part of the tool works. We've also included an evidence guide as part of that tool, so if you're not quite sure where to find evidence to support whether how you might score that particular provider, that gives you a little bit of a guide as to where to find that sort of appropriate evidence. This shot here highlights the various flags that are raised depending on how you've scored. So if you're in the 4 to 5 bracket, it's generally a green flag. If you're sort of round about that 3 area, it's more an orange flag, and sort of 0 to 2 is more the red flag. The way the flags work, probably green, no real need to do terribly much. It's not a risk that's presenting itself. Orange flag, probably an area to have a bit more of a think about, and a red flag is definitely something that requires active consideration. The next slide sort of takes those particular risks that have been identified, be they orange or red, and this is just a sample taken here as to how you might go about describing the risk, and then the middle section is really how likely or otherwise is that risk to occur, and then the final sections on the right hand side following your sort of risk rating are what are you going to do about that particular risk. And the 2 boxes on the right pick up whether you want to mitigate or manage that risk through contract, in which case you want to put a clause in your outcome agreement, or whether you think that risk can be managed or mitigated through good contract management practice, in which case you might do something in your outcome agreement management plan. So that's kind of the screen that you'll be presented with when you've done all of that. To give a little context, we used this tool, a slightly more primitive version in the pilot program with one of the providers, and we found it took around about 30 odd minutes to run through all of that. And it was also quite a powerful tool for sharing that information with the provider and building trust and confidence with the provider about the way we'd identified risk and what we then wanted or felt we needed to do. So it provides the basis for a good interactive discussion with your provider. The other thing that we have looked to embed in the contract that I mentioned earlier is this RBA. And RBA, for those who are unfamiliar, is results-based accountability. It's an outcome measurement framework for thinking about how you identify and then track progress against outcomes. It's the brainchild of a man called Mark Friedman, who authored a book called Trying Hard is Not Good Enough. And that sort of runs through a number of different scenarios and ways of thinking about outcomes and how do we improve our attainment of those outcomes. It's used pretty commonly internationally and in New Zealand. A number of different sectors within New Zealand, particularly the broader social and public health sectors, use those. I know it's used by the Ministry of Social Development. It's also used in health circles, environment circles. I know some sport and recreation contracts have RBA embedded into it as well. For us, it's an integral part of the Streamlined Contracting framework, and the reason it's so important is that because we want to create more of an outcome focus to our contracts with NGO providers, we need some way of creating a link between the services we're buying and the outcomes we're hoping to achieve. And so for us, the RBA framework is a nice, simple, easy to use framework that will hopefully let us track whether we're achieving those outcomes or not, whether they be at a client level or how those client level outcomes contribute towards population outcomes. The other reason we like RBA is that it puts a spotlight on the effectiveness of the services that are being purchased, which is why we want to create that link. In all cases, RBA measures more than just counting activity, so that it's not a head count based thing. It asks a series of questions that are targeted around finding out whether your client or the end user of your services are any better off after having gone through the service that you're offering them. For us, there is that better offness is a key component to getting a greater outcome focus. We've looked to embed those RBA principles, particularly in the outcome agreement, but also in the outcome agreement management plan, because we think that it's a very useful, relatively easy to understand outcome measurement framework, and we want to make sure that agencies are using that and hopefully getting the best out of it. Coordinated audit. This was kind of an interesting topic when we got the pilot project started. We did quite a lot of analysis on the way different government agencies look at auditing or measuring the performance of their NGO providers. In particular, audit was an area where there was a bit of room to improve. Lots of government agencies tended to do fairly similar audits, so that particularly what I think of as business viability or financial audits, you know, things like have they got an appropriate health and safety policy, and have they got appropriate HR policies and appropriate financial controls in place to operate as an organisation. Those kind of things were frequently done by government agencies, but they generally all result in the same information. But because the government agencies do it individually and weren't sharing that information, there was quite a bit of scope to remove some duplication of activity and then also remove the compliance cost on the NGO provider, because each time a different government agency turns up and asks those questions, it requires input from that NGO provider to provide answers to those. So what we've looked to do is try and create a coordinated audit platform, I guess, which we're looking to build a kind of IT tool that will tell us who's doing what and when, so that hopefully the government agencies will share a little bit of that information, particularly the business viability and simple financial audits that are done, as that's an area where we should be able to rely on the information that others unearth as part of that audit activity. The other thing that we've considered is how we go about actually doing those, whether we would look at creating perhaps an audit window or something, and that's still a work in progress as to how do we really streamline and make the most of a coordinated audit arrangement. But that's something that we will continue to engage with both providers and government agencies on how we do that most efficiently. This slide here outlines the key benefits we think with the streamlined contracting approach. I won't talk to all of them, but of the 7 that are up there, I think the ones that are the most important are placing a greater focus on service delivery rather than all the time and effort going into negotiating the terms of a contract. We want to see more effort put into frontline service delivery that has a positive impact on the lives of the clients who are receiving our services. The other one is around the contract terms. Again, when viewed across all of the different agencies that participated in the pilot, we're confident that the contract terms are fairer to NGO providers than anything else that is currently offered as a standard contract to NGO providers by government agencies. The last couple are things that I consider to be quite important. The information that we can gather from adopting more of an outcome focus to our contracts, that information can be quite powerful in terms of working out whether we've got the right programs and the right provider mix to deliver those, so that we are making the positive impact that we're looking for in terms of improving the lives of those people who use those services. And I suppose the final one, which is sort of wrapped up in some of those, is that by placing a greater focus on the outcome we're wanting to achieve and managing our contracts to test whether we're achieving those outcomes, we stand a much greater chance of actually doing the improvement activity that will make that positive difference. The project that we have running currently is divided into 5 work streams. The first work stream is about stakeholder engagement, which is really just making sure that all the key stakeholders, and there will be multiple stakeholders from those on the government side of the fence and those in provider community, and a number who straddle those or are associated with either side. They need to be made aware of the project and hopefully support and endorse the direction of travel. The second work stream is around further testing and refining the contracting framework. We are hoping to have the finalised contracting framework up very soon on our website, but one of the areas where we weren't able to go during the pilot was to look at how that contracting framework might apply for Crown entities and particularly district health boards. And so we have a separate stream of activity around making sure that the contracting framework we've created can work for those Crown entities and finding out where it perhaps doesn't and what we might do to amend that so that we do have a fit for purpose contracting framework that can apply more widely than just to government departments. The third work stream is around the training and education program that we've got running. The earlier slide that showed there were 5 component parts to the contracting framework. In many agencies, they will do some of those 5 components, but perhaps not broken up the way we've chosen to structure them for this. We need to make sure that we're training both the government agency personnel and provider personnel so that they have a degree of familiarity with those particular aspects of the contract framework. And our training and education will include webinars, looking at sort of exemplar contracts, user guides, frequently asked questions, that type of thing, so that hopefully people in both agency and provider land will find it relatively easy to get the information they need to feel comfortable with using the new contracting framework. The fourth work stream is around our IT. What we're looking for through our IT work stream is to get, I guess, 3 things. One is the contract register, which will provide a bit more of a snapshot of who's doing what, which again, that was one of the barriers that was identified fairly early on in the workshop back in 2011. We think that contract register will shed quite a lot of light on that and enable greater collaboration between government agencies, all of which should be targeted at hopefully reducing the compliance burden that NGOs currently suffer. The other 2 parts of the IT work stream are that audit tool that we discussed a few minutes ago, and the third one is finding a way to easily look at the performance measures and the tracking of services through to client and population outcomes or community outcomes. So those things are currently works in progress, but we will provide further updates on those as and when we've got more information on those. The final work stream is one that we've called transition support, which is around MB looking at working with each of the government agencies that wants to start using the new Streamlined Contracting framework and making sure that we know where they want to start, who needs to be trained and educated in the new framework so that they can actually make the most of that. And also so that if there are agencies out there who are wanting to use this for for contracts that begin on 1 July 2014, they've got their people trained to be able to pick those up and work with them. This slide just represents a little bit of a timeline in terms of what we're looking at doing. And you'll see that the training and development stuff is designed to make sure that we get as many people trained as quickly as possible. Although we're conscious that if we don't get a huge uptake for the 2014-15 contracting year, we'll need to extend our training and education program so that as people look at contracts for the following financial year, we can still provide training and education for them so that there isn't too much of a gap between when they're trained and when they actually start using the various tools. In terms of what should you see next, for those in government agencies, we have representatives on our various working committees, and hopefully those people will be getting in touch with you around the contracting framework and also what parts of your organisation may be looking to transition across to the new contracting framework. We're looking at getting our training and education program running from early next year so that it is in time for that 1 July 2014 contracting round. And I guess the other thing to note is this program is a 3-year program that's begun this year. Transition is designed to be phased, so there is still business as usual activity to continue with in the interim. In terms of questions and contact details, for anyone in the live audience, I'll happily take any questions now, but for those that are on the web, more than happy for you to email me directly with any questions that you may have. If the question relates to when might my contract be coming across to the new framework, I would suggest that your contact person in your government agency can better answer that than I can. But otherwise, I'm happy to take any other questions and comments on the Streamlined Contracting framework. Information will generally be put on our procurement.gov.nz website, so we've got information there already about the program, and as we upload each of our tools and user guides and things like that, that website is where they'll go to. I just thank everyone for listening. I hope the presentation has been informative and helpful. Thank you.